Good morning, Chair Harrington and board. It's kind of sad that I'm back in front of you. It's a sign that our numbers are not going in the direction that they had been and that we hope. So my hope today is really just to provide you with an update on the numbers around the pandemic so that it's background and context for you as you have your discussion this morning. So next slide. So as usual, starting with the Oregon numbers, this is as of August 6th, the cumulative total 226,899. Our statewide case rate is 129.3, which does put us in the CDC substantial spread category for cases. Cumulative deaths, you can see 2,880. Test positivity going back up. I don't know if you remember, but we had been below 3% for quite a while, so that's quite the jump. And the statewide 2-week average for new hospitalizations is 143 per week. So people are continuing to get very sick and be hospitalized. Next slide, please. So you've heard a lot about what's causing this increase, this spike that we're seeing nationally as well as statewide, and it really is the Delta variant. And so you can see that beginning in mid-June and then particularly increasing in July and into August. The yellow bar is the Delta variant. So you can see that that is primarily what's driving this increase in Oregon and in Washington County. So next slide. So county community level spread in Washington County, like the state, we're in substantial spread category. So in a 2-week period, we had 660 cases, which puts us at a case count, a case rate of 106.4. And our test positivity is also above the threshold per the CDC substantial spread. And you can see that also our neighboring counties are also in substantial spread according to the OHA categories and high risk according to the CDC. And it's my understanding that OHA is looking toward aligning more with the CDC spread indicators so that we won't have to show you both hopefully in the near future. So we'll go to the next slide. So this is moving into the folks that are vaccinated. And I guess what I would really point out here is when we report vaccination, we're reporting of the eligible people over the age of 18. So when we say 76.2% are vaccinated in Washington County, which still is the highest in the state, so we can celebrate that. That's good news. But remember, that's of people that are eligible over the age of 18. So that doesn't represent our entire population. And then the second number that you'll see right after the triangle, that's the discouraging number, because that is the percent of change over time. And you can see that that is less than 1%. And we have had that for several weeks now. And so the vaccination demand has really slowed down, and that's what you're seeing in this slide. And you can see that it's similar across all of our metro counties. So next slide. So this is just another look. The darker the shade, the higher the percentage of vaccinated population. And again, that's eligible population, and you can see the number of doses. And that's number of doses, not number of people. So I also just want to make sure that that's clear, that have been provided since we began vaccinating in Washington County. And you can also see where that high demand was on that epi curve, where we were vaccinating several thousand a week, and then now it has come to just a trickle. So next slide. So this is Washington County vaccination data by race and ethnicity, and this is really important to look at because you can see that we still have significant under vaccination in our BIPOC community, in particular among Hispanic and Black populations. And so we still have lots of work to do in that area. And that continues to be really the focus of our vaccination team, is looking at opportunities to get the hardest to reach populations, people that are most hesitant, that have fears about vaccination. And so we're really doing everything to focus on everything we can to focus on increasing vaccination among those populations. Because again, with Delta virus and with the spread, vaccination is extremely effective in preventing hospitalization and death. So you may have heard a bit about that people who are vaccinated can still have breakthrough cases. And with the Delta virus, we are seeing more breakthrough cases, but vaccination protects people from hospitalization and death. So it is still by far the most effective tool that we have in saving lives and preventing hospitalizations. The next slide. So this is looking at hospitalizations, and this is Washington County hospitalizations. And so I think, you know, what you're seeing here is that we have had some increases, but inconsistent in Washington County among or with hospitalizations. What you're hearing quite a bit about is the strain on the metro area health systems and hospitals, and that's related to lots of different variables. So some of it is related to staff shortages, which you've heard a bit about. Some of it is related to people are sicker and they're staying in the hospital longer, and there's been difficulty discharging. And some of it is driven by our surrounding counties with very low vaccination rates, as Chair Harrington heard from Director Allen, I think last week. So right now in Washington County, likely because we have a higher vaccination rate, especially among the elderly, we aren't seeing as big of numbers as other places in the country, but definitely it's concerning, and we're watching the hospitalization rate. And so with that, I just wanted to give you some background and some numbers, and I'm happy to answer any questions and be available as you have your conversation related to any other restrictions that we want to consider within Washington County. And I think the next slide just is a place for questions or placeholders. So